Hi, I'm Dr. Alison Grimaldi, and today we'll be talking hips. Making the decision to undergo total hip replacement is something that patients with hip osteoarthritis may agonise over, and understandably so. Usually this is a very successful procedure, with the potential to substantially improve function and quality of life. However, it is a big operation with inherent risks and costs. I regularly see patients with hip OA who come along to see me with a very specific question in mind. Is it time yet? Is it time to get my hip replaced? There are many considerations that determine the right time for each individual. In an interview I recorded with Dr. Patrick Weinrauch, orthopaedic surgeon, he shared his key criteria for eligibility for total hip replacement. 1. Severity that is impacting on function. 2. Persistent pain over a longer duration of time. 3. Pain that has been inadequately responsive to non-surgical therapies. 4. The patient has completed a good trial of non-operative therapies appropriate for their condition. And 5. There is established wear on imaging modalities. If you'd like to hear or read more of this detailed interview, you can find all the information in the blog for this topic. Thanks for joining me, and I'll see you on the next episode of Talking Hips with Dr. Ali.